My name is Owoyemi Shugo. I'm a underlevel student of healthcare management and nursing GPTS Joint Professional Training and Supported Institution of Science Management and Technology. GPTS is affiliated to Pan American University, South American University, West University, Togo, among others. The purpose of this presentation is for the partial fulfillment of BSc requirement in healthcare management and nursing. My topic for this presentation is abuse of antibiotics and its effectiveness on the health of Nigerians. Antibiotics are medicines that fight infection caused by bacteria in human and animals by either killing the bacteria or making it difficult for the bacteria to grow and multiply. Bacteria are germs. They live in the environment and all over the inside and outside of our bodies. Most bacteria are harmless and even helpful to people, but some can cause infection like strep throat. This 10 paper looks to discuss what antibiotics are, its classification, how and when they are used, and how much effect they can get when they are abused. Antibiotics drugs have various classes, among which are aminoglycoside, carbapenems, celecoxib, fluoroquinolones, galactopeptide, among others. Now we talk about on some of these classes which I mentioned earlier. Aminoglycoside are natural or semi-synthetic antibiotics derived from artemonocytes. They were among the first antibiotics to be introduced for routine clinical use, and several examples have been approved for use in humans. The carbapenem antibiotics, imipenem, meropenem, etiopenem, and dipropenem have a broad antibacterial spectrum which activates against almost all aerobic and anaerobic pathogens, although Enterococcus faecal and resistant cephalosporin are a class of B-lactam antibiotics originally derived from the fungus. Acrimonians, which were previously known as celiparon, together with celebrexa, they constitute a subgroup of beta-lactam antibiotics called Cephin. Now, antibiotics do not work for various infections such as cold and flu, and most cough and sore throat. Antibiotics are no longer routinely used to sore throat. When it comes to antibiotics, take your doctor advice on whether you need them or not. People at a higher risk of infection may also be given antibiotics as precaution, known as antibiotics prophylaxis. Antibiotics are sometimes given as a precaution to prevent rather than treat an infection. This is called antibiotics prophylaxis situation, where antibiotics are given as a prevention treatment include if you are having an operation, bite or wound, people who have had their sibling removed, people having chemotherapy, people with sickle cell anemia, etc. Now, what are some of the side effects of abusing antibiotics? They have antibiotics resistance. When antibiotics are misused, the bacteria are not effectively killed. Instead, the bacteria adapt mechanism to resist the inability effects of the antibiotics. Advised side effects. Antibiotics can cause various side effects. Their side effects range from symptoms as upset stomach or rash to potentially life-threatening conditions such as severe allergic reaction, kidney injury, and liver damage. Now with this, I believe we all have known the effect of abusing antibiotics and the disease from such practice. My name remains Owoyemi Shugo.